Hello, so this video is about treatment planning for substance use disorders. What are treatment plans? A treatment plan is a written document that identifies the customer's most important goals for treatment, describes measurable, time-sensitive steps toward achieving those goals, is time-limited, and reflects a mutually agreed-upon written agreement between the clinician and the customer. Serves as a bridge between assessment and treatment, and is individualized. Why are treatment plans important? They provide the customer a roadmap to the recovery process, provide structure, very important, especially for customers who have experienced a chaotic lifestyle. Is outcome driven, helping both the customer and clinician remain focused on the purpose of treatment. Having a well-written, individualized treatment plan that has been reviewed, approved, and signed by the customer is very important since we live in a litigious society. Treatment plans should be paired with thorough progress notes addressing what has been accomplished during sessions, while incorporating the goals and objectives of the treatment plan. Indicates what services the funding body is purchasing. Developing a treatment plan. The foundation of any treatment plan is the data gathered in a thorough biopsychosocial assessment. Assessing how substance use impacts all major life areas such as employment, legal, family, medical, and financial is a key piece in the development of treatment plans. Treatment plans need to be tied to your ASAM. If a client has a significant issue identified on their ASAM, but there are no goals in this area on the treatment plan, this may be a flag that client is not receiving appropriate care. For example, if a client is concerned about social environment and whether or not they and their children will be safe that night, they are not in a position to respond to even the best therapeutic interventions targeted at relapse triggers. After gathering the clinical information mentioned above, the goals and objectives are developed into an individualized plan through a logical series of steps that build on one another: problem statement, goal, objectives, and interventions. Identifying problems / developing problem statements. Problem statements are based on information gathered during the assessment. A brief clinical statement of a condition that the customer needs treatment. Look at the most significant issue present in the customer's life. Substance use will show up as a primary and secondary problems. May also surface such as ADHD, impulsivity, and anxiety. Identifying the problems that are most accurate, acute, or troubling to the customer's functioning and balance. This with what is most important to the customer. Identifying problems / developing problem statements. Continued. An effective treatment plan will address a few selected problems. Otherwise, the direction and focus of treatment gets lost. Problem statements should be related to customer's diagnosis. Example, if they have no mental health diagnosis, should they be attending a co-occurring group? Review the DSM-5 for diagnostic criteria and codes. The concepts of mild, moderate, and severe for substance use disorders are different, so you have not begun. If so, you have not begun this process. You are strongly encouraged to do so. Creating a goal. A brief clinical statement of the condition you expect to change, tied to the assessment and problem statement. Set broad goals in order to replace dysfunctional behaviors with healthier ones. Think long term. Goals are based on the problem statements and reasonably achievable in the active treatment phase. At least one goal should relate to an SUD condition and treatment. Goals and objectives are often confused in treatment plans, so keep in mind there is a difference. If you can see the customer do something, i.e. complete a journal entry, attend AA, etc., then it is an objective. If you can't see a customer do something, reduce anxiety, accept powerlessness, it is a goal. Creating objectives. Objectives are what the client will do to meet those goals. Think skills development. Objectives, visible, must be stated in behavioral measurable language, and it should be very clear when the customer has completed the objectives. Should be stated so clearly that almost anyone who would know when he or she saw it. Objectives are the skills developed by the customer, and when accomplished will result in achievement of the long-term goal. Each objective should include a target end date for completion. The objective end date located in the treatment plan should not exceed the authorization request end dates submitted to SWMBH or your local process for a sub-cap country. So think SMART with objectives. You want to be specific, write exactly what the client will be doing to develop skills, try to avoid too many commas and ands. Measurable, generally use numbers to quantify. Could someone else observe the skill and determine if it was completed? Attainable, is the objective attainable, realistic within time in treatment? Relevant, the objective must be related to the assessment, problem statement, and goal. Is it related? Is it related to SUD? Time limited, is the target completion date reasonable and individualized? Are these SMART objectives? To develop healthy coping skills? No. Client will participate in individual and group counseling regularly? No, because it's not specific enough or measurable. Comply with the court by completing the program? Not really measurable. Well, it is probably relevant, but it's not time limited. Develop a support system? Once again, no. Learn about addiction? No. And develop a sober lifestyle? No. None of these are SMART. Interventions. Interventions are actions of the clinician designed to help the patient complete the objectives. What you do as a clinician to help the customer complete the objective should also be written in a measurable way. Services can be considered a form of an intervention, so IOP, case management, outpatient, peer services, etc. If you're using EBPs, this is where they should be documented. Check your work. Before you have a customer sign, is your goal related to your assessment? Do you have at least one SUD treatment goal? Are your objectives SMART, and do they relate to the goal? Are your time frames reasonable and not just matching your authorization? Have you described your interventions in a way that accounts for the good work you are doing? Do you have more than one goal that accounts for the needs of the client? Is the treatment plan signed? Why is all this necessary? In addition to the good clinical reasons above, which assures the best care for the people we serve, all of our dollars come from the federal government and originate from the Balanced Budget Act. This comes with a strict set of regulations. Good clinical practice dictates what you do, but the BBA and Medicaid rules dictate how you document it. We are accountable to the taxpayers for all of the dollars we spend. Medical manual. The document that identifies the needs and goals of the individual beneficiary and the medical necessity, amount, duration, and scope of the service and supports to be provided. For beneficiaries receiving mental health or developmental disability services, the individual plan of services must be developed through a person-centered planning process. Medical necessity. Determination that a specific service is medically appropriate, necessary to meet needs, consistent with a person's diagnosis, some symptomatology, and functional impairments, is the most cost-effective option in the least restrictive environment and inconsistent and is consistent with clinical standards of care. Medical necessity of a service shall be documented in the individual plan for services. Treatment plan updates / progress reviews. Updates should be completed when a customer completes a goal, requires a different level of care, or something significant occurs that requires an adjustment in the treatment plan. ASAM should also be updated during this time to account for any changes of the treatment plan. Progress reviews should include enough narrative to support any request change in level of care. Describe customers' progress towards current goal and rationale for any continual goals / objectives. Treatment plans will be reviewed at every 90 days. So they show the administrative rule here at the bottom that shows that a treatment plan shall be reviewed at least once every 90 days. At the clubhouse, we use action plans, and it's basically the same thing because they don't provide treatment, so they provide, it's an action plan. So this is a sample treatment plan example problem. Using drugs has caused too many problems in my life. Goal number 1, I want to stop using drugs and figure out how not to relapse anymore. Objective number 1, write a detailed chemical use history describing treatment attempts and the specific situation surrounding relapse, when it was established, targeted completion, completed on, and that leaves a spot for that. Objective number 2, list triggers that may lead to relapse. An objective establishment thing and completion again. Objective number 3, develop a written relapse prevention plan. Interventions. Clinician will have the customer write a chemical use history describing their attempts at recovery. Clinician will provide education about high-risk situation, facilitate identification of triggers, and assist customer in completing a relapse prevention plan. Interventions will be provided during individual sessions. Frequency, 60 minutes per week. Duration, 4 months. Example 2 here. Problem, I will lose my family if I don't stop drinking. Goal number 2, begin to resolve family conflict while maintaining a program free of substance use. Objective 1, in session, verbalize an understanding of how family conflicts lead a substance use and substance use led to family conflict, and complete a worksheet to review the family. Objective 2, identify 3 non-using friends to socialize with, and then objective number 3, identify high stress situations with family that might lead to drinking. Intervention, clinician will explore relation between substance use and family conflict during an individual session using motivational interviewing and CBT. Clinicians will assist client with expanding social support that includes non-using friends. Frequency, weekly, 60-minute individual sessions. Duration, 4 months. Problem, I'm addicted to drugs. It's something that's controlling my life. Goal number 2, I have to figure out a way to make recovery work. Objective 1, client will identify triggers that can lead to relapse. Objective 2, client will learn new ways to cope with high-risk situation as evidenced by, and then you'd put how it would be. Objective number 3, client will expand social support by identifying activities that are substance-free.